Okay, chapter 17. This is one of my favorites to talk about because I think it's super important and it's about having hard conversations and what that looks like with our clients. So, additive empathy, interpretation, and confrontation. Okay, so there we go. Number one, these are advanced skills, right? And the relationship we have with the client matters, okay? This is the number one most important takeaway I want you to get from this mini lecture or from anything you read. The relationship matters, okay? So imagine meeting a client for the first time and saying, "It sounds like you like to push people away because you're afraid that they will eventually abandon you." Okay, so even if that observation eventually proves useful, maybe it is true and it needs to be explored in therapy. The client may very well think, "You met me 20 minutes ago. You don't know me." Okay, so compare that with a similar observation after weeks of developing trust and rapport and understanding of the client's experiences, their coping skills. Then you say the same statement, and it might have a completely different impact, depending on who says it, when you say it, how you say it, right? And this is why skills shouldn't be used simply because the social worker has developed an interesting hypothesis. Okay, so something to consider: am I saying this because it will help my client, or because I want to demonstrate that I figured something out? And it should always be the first part. All of our interventions should always be about helping the client. Okay. Number two, additive empathy. And this is all about hearing what's underneath the words, like the words that our clients are saying. Okay. So you've already learned about empathy. You've already learned about empathetic responding. For most of you, this probably comes naturally. So instead of simply reflecting on what the client said, we want to get under the surface of it. So, for example, the client may say that, my daughter moved 3 hours away, but she's fine. She's an adult and, she has her own life. So, a basic empathetic response might be, "So you understand that she's an adult and she needs to make her own decisions." But additive empathy might be, "Well, you understand why she moved, but I'm wondering if there's also a part of you that's really missing her." So we're adding something in there without explicitly saying it. And that's why it also needs to be tentative, because the client might respond with, "Yes, like I miss her so much. I miss her terribly." Well, great. We've helped the client access something that's a bit deeper. But the client might also say, and this does happen a good bit, "No, I'm actually really happy for her." And that's okay too. So, additive empathy is more of an informed hypothesis, not mind reading. Next, we want to pay attention to what's underneath anger. Okay, and I did this just the other day with a client. The underneath stuff was grief. We had to unpack that. So anyway, clients may initially present with one emotion, while another emotion is more difficult to express. For example, "After everything I've done for him, my son didn't even call me on my birthday. I'm done. I don't even care anymore." So, obvious emotion here is anger. They're frustrated. But the social worker might wonder whether something is underneath it. So, we might say, "You're really angry with him. And I'm also wondering if some of that underneath anger or underneath that anger might be hurt." So, that is additive empathy. Maybe the client pauses and says, "Yeah, of course I'm hurt. I'm his mother." Well, now we've moved from the surface emotion of anger to something that's more meaningful: hurt, rejection, disappointment, grief. Y'all see my dog back there acting a fool? Okay, sorry, refocus. But we don't tell clients what they're feeling. We offer them something to consider, right? We're not going to say, "You're feeling this." We offer them the opportunity to consider another emotion, and then we see if it's right, if they agree, and then we can go from there. And interpretation, next, helps clients make connections. So it's just another step in the process. So here we're helping clients recognize connections, themes, patterns they may not have previously recognized. So, for example, a client may say, "Every relationship I've had ends in the same way. Eventually, I just start to feel suffocated and I leave." Well, over time, you learn the clients had significant experiences of loss or abandonment. So eventually, once rapport has been established and trust has been built, we might say, well, I'm wondering if there's a pattern here, right? Like it seems like when relationships become especially important to you, you start pulling away. And I'm wondering if whether leaving first might feel safer than risking someone leaving you. So that's an interpretation. So the language, I'm wondering, it seems, I'm curious about. So compare that with, you leave people because you're afraid of abandonment. That sounds like the social worker is like announcing a diagnosis, or like, I don't know, like being very confrontational about what's happening with the client rather than interpreting or helping the client to interpret what the underlying message might be. And so we want to avoid presenting our interpretation as the truth, and again, allow the client explore the idea. Next, the client gets to decide whether the interpretation fits. And this is really important because, believe it or not, y'all, social workers can be wrong. I know. Our education, experience, assessment skills, they don't give us the magic access to someone's unconsciousness or motivations, their thoughts. I always say, I wish I had a magic wand, but I don't. So if you say, as a social worker, I'm wondering whether you avoid asking your family for help because you're afraid they'll disappoint you, and the client says, no, that's not really it, don't argue, right? So we're not going to respond with like, actually, I think you're just having trouble recognizing it. Instead, we might say, okay, well, tell me what maybe feels more accurate to you, because that's going to communicate something really, really important to the client. It is that the client remains the expert on their own experiences. That is so crucial, so important in the helping process. The client knows themselves best. Next, confrontation does not mean conflict. And I love talking about this with students because immediately when we hear the word confrontation, we're like, I don't want to do it. But I think it's a huge misconception, and it's actually a clinical skill. So I think when people hear confrontation also, most people imagine, I'm not going to confront this person about what they're doing. And it sounds aggressive. It's uncomfortable. But in social work practice, confrontation is about gently, once trust and relationship and rapport has been established, drawing attention to discrepancies or inconsistencies and maybe seeking further clarification. So we might notice a discrepancy between what the client says and does, or what the client says they want, but then the choices they make. Maybe two things the client has told you in one session and they say something different in another session or at different points in a session. The client's values and behaviors, verbal and nonverbal communication. And so the purpose of confrontation is to notice that something may be getting in the way of their goals, and we're bringing it to the surface for the client. Which brings me to my next point, and that is we want to confront discrepancies with compassion, okay? So you've told me, here's an example, you've told me how important rebuilding your relationship with your daughter is, but you've also canceled the last 3 visits with her, and I'm wondering if we can talk about what's getting in the way. So 3 important things happening here. Number 1, we're affirming the client's goals. You said you wanted to rebuild your relationship with your daughter, and that was one of your goals. So we want to remind our client of that. Secondly, we're identifying the discrepancy without judgment. We're just stating, this is what happened. You've canceled the last 3 visits with her. And then we're inviting exploration, right? So I'm wondering if we can talk more about that. Versus, you keep saying your daughter's important, but then you keep canceling on her. Right? So completely different experience for the client. It's a confrontation, but it's done without judgment, and it's done with a different sense of calmness and less aggression than just calling it. Another example, discrepancy between words and nonverbal behavior is important, and confrontation can be really subtle here. So here's another example. Maybe the client says, no, I'm fine talking about my father's death. But when they say that, they stop making eye contact, they cross their arms, and maybe they start to cry or they look down. So here the social worker might say, well, you're telling me it's okay to talk about it, but I noticed that you became tearful and you looked away when we started talking about your dad. What's happening right now? So notice we didn't say, you're obviously not fine. right? We simply just put two pieces of information next to each other, and then we give it to the client to explore what's happening or like what the discrepancy is. I did this today in a session. A client was saying they were fine talking about something, but they were totally flat about it. It was almost like a shift in mood. And I just I just said it. I just named it. I said, you said that you were okay talking about it, but I'm sensing maybe something a little different right now, based on X, Y, and Z, what I'm observing. Tell me about that. Okay. Confrontation should connect to the client's goals, and this is really important. We don't want to confront simply because you don't like it, right? We always want to ask, how is this discrepancy relevant to what the client told me they want, what their goals are? So for example, a client may say their primary goal is improving their health, but reports eating fast food 4 nights a week. So there's technically a discrepancy. But immediately saying, well, your health is important to you, but you're still eating fast food, it might come off as being a little judgmental and not very helpful. So we might need to understand the context. So maybe the client works 2 jobs and they have limited money and there's no reliable transportation and they're feeding 3 children, right? So context matters, and that's why, that's where our social work perspective becomes really important. Timing is everything. So a perfectly appropriate intervention delivered at the wrong time can be totally bad intervention. And so before using interpretation or confrontation, I want you to think about, have I developed enough trust with this client? Do I have enough information to make the observation? Is the client emotionally stable to hear this right now? If they're having a really bad day, or they're in a crisis, or they're extremely emotional, this might not be the time to bring this up or to actually use this confrontation. Is it relevant to the client's goals? Can I say this without judgment, without sounding really judgy? And am I willing to be wrong? Which again, it happens. We're wrong sometimes, a lot. And one more, what am I going to say after? Whatever their response is, what am I going to say after it? So sometimes I think new social workers or new clinicians can be so focused on delivering the perfect therapeutic statement that they forget that the client still has to respond. So make the observation and then remember that skill of giving space for processing, for quiet. Give the client space. Silence might be what they need, okay? All right, the big takeaway here, one thing to know, these skills aren't about showing clients what you know. We know you know a lot. You're going to get your MSW and you're going to get licensed and you're going to be an awesome clinician, an awesome social worker. But these skills are about helping clients discover something about themselves, especially when we're using confrontation. It feels like make it feel like an invitation to become curious, not an accusation, right? That demands a defensive response. If the client immediately feels the need to defend themselves against you, the intervention is probably not accomplishing what you intended.